Good evening, sir. Thank you for honoring our invitation. We are from NK Systems Limited, an assisted reproduction consultancy expert based in Benin City, Edo State. We just have some few questions on IVF and other related questions about IVF. Please, sir, the first question we have today is, what is assisted reproductive technology?
Well, thank you for your second visit to my office. I think the last time you came here, we did discuss something about understanding of our viewers at home. I think it would be ideal for me to a little bit digress from this your question now to what we initially discussed on IUI. IUI, intrauterine insemination, has fundamental reasons why the procedure is carried out on some infertile couples. But in this case now, assisted reproduction technology, of which IUI is one of the assisted reproduction technology or techniques, which is an advanced form of infertility treatment for our infertile couples. The technology, the word technology there is the art of applying the technique to achieve pregnancy for our infertile couples who might or who may require that method of treatment. So in a nutshell, assisted reproduction technology is defined as any art or technique applied to achieve pregnancy for our infertile couple that will likely use that method. If you remember the last time you came here, we discussed the selection criteria for intrauterine insemination. In the female, we said such female should have her tubes open or one open, not blocked. The womb must be free from any abnormalities, and the semen count of the man must be at least appreciably normal. For those who must have had azoospermic condition, in other words, no single sperm cells in the ejaculate, we'll look for semen donor for them. This is what I discussed with you the last time you visit. But in this case, assisted reproduction technology deals with the art of applying these techniques, of which one of them is what? IUI. So this is the definition of assisted reproduction technology.
Okay.
Yeah.
What is the main difference between IUI and IVF?
The main difference between intrauterine insemination, which is IUI, from in vitro fertilization, which is IVF, is this. For the female, for an infertile female to be regarded as qualified to run IUI, one of the main conditions is her tubes, what we call the oviduct or the fallopian tube, must be opened. Either the two opened or one open, the other one block. Such a woman will be regarded as qualified for IUI. But for IVF, the difference between IVF and IUI is one, both tubes of the woman, where the egg and sperm will meet, they are both blocked. Because that is where the egg and the sperm supposed to meet, they are both blocked. The sperm have nowhere to meet the egg because of that blockage. So this is one of the main difference between IUI and IVF. In other words, candidate for IUI, for the female, the tubes must be opened. The semen count of the man must be okay. But for IVF, the tubes are blocked, and also the semen count, besides being okay, depending on the semen count, we can also apply it to achieve IVF for that particular couple.
Okay.
Yeah.
So who are those people who consider as candidates for IVF treatment?
That's a very good question. It's just like you asking me, who are those people or persons or candidates or patients qualified for IUI? But in this case, this is the opposite of that. For in vitro fertilization, IVF means in vitro fertilization. Now, for us to say, yes, this couple, you are candidate for in vitro fertilization, these following conditions or criteria are involved. One, depending on the age of the woman, her tubes are blocked. Don't forget the function of the tube. There is total blockage, where the doctor may make an attempt or the clinician to open it, but the benefit of opening those tubes to achieve pregnancy is very slim. So those kind of patients whose tubes are blocked, I mean the female, whose tubes are totally blocked, they are potential candidates for in vitro fertilization. Then for the female too, they have abnormality in the womb and whatever that impedes pregnancy or impedes fertilization in IUI. They are also potential candidates for IVF. For the male aspect, which is the spouse or the male or the husband, let me use the common language so that our audience will also understand. No matter the count, no matter the semen profile of the husband, IVF can come to the rescue. I think at this juncture, let me push in some few things for our audience to understand what assisted reproduction technologies through techniques is all about. One of the techniques in IVF, if I'm to answer this your question very well, is one, IUI. That is what the word assisted comes in. IUI is one of them. Intrauterine insemination, which I have earlier discussed. In that one, the tubes of the womb must be open to allow passage of sperm and the ovulated egg. Then two, in vitro fertilization, which we are not discussing now, it is one of the assisted reproduction techniques. The tubes of the woman, they are blocked. Because passage of where the sperm and the egg is supposed to meet first, fuse together to form the baby. Let me use the common language so that our audience will also understand, is blocked. So that is one of the assisted reproduction technology. We also have what we call intracytoplasmic sperm injection. Let me use another language. is another type of assisted reproduction techniques. This, I told you in IUI, the sperm must be normosospermic, means the sperm must be normal to a certain level for us to use. That also depends on the age of the woman. But in IVF, no matter the quality and quantity of the sperm, no matter how oligospermic the sperm is, no matter how severe, we can apply a technique called intracytoplasmic sperm injection. It's a powerful machine that will select the sperm no matter how few they are, singly, depending, then eject each egg of the woman, provided they are good eggs. And God's willing, those ejected eggs will fertilize after about 17 to 24 hours. So this EC, we call it EC, ICSI, intracytoplasmic sperm injection, is one of the assisted reproduction techniques. Now, we also go to what we call ET. ET means embryo transfer. The final product that results, I repeat, the final formation or product that results from the union of the sperm and the egg to form the embryo, which is now finally transferred to the recipient, which is the woman, is called embryo transfer. Okay, because after the union, we allow it to develop to a certain level where we will now say, yes, this embryo, you've been outside for 7 days or 5 days or 3 days or 2 days. Let us move you to your natural habitat, which is the uterus of the woman. And that woman's uterus must be free from all abnormalities, so as to allow that baby to implant, or the transfer baby to what? Implant. That is another assisted reproduction techniques. Now we have what we call assisted hatching. You see, I just hope my audience will get all this is clear. Assisted hatching. There are some of these embryo resulting from the sperm and the egg. The outer wall is very hardened, and it prevents implantation in the womb of the woman. So we can do assisted hatching, means we can hatch the egg, hatch the embryo outside the body and transfer it to the woman. It is common, some of these eggs that are coming from these our women who are above 35, 40, or thereabout. There are other factors also. That is one of the assisted reproduction techniques. Now we have what we call SD, semen donor. We did mention this in IUI. We also have semen donor too in IVF, what we call in vitro fertilization, where the woman have been examined clinically, then investigated to discover that her tubes are blocked, and this woman's age, assuming this woman's age is between 25 to 30, her tubes are blocked. 1, 2, there are abnormalities or no abnormalities in the womb, but this spouse, which is the husband, is azoospermic, means no single sperm in his ejaculate. Whatever he is producing, there is no single motile sperm that's supposed to have fertilized this young woman's egg. So what do? Assisted reproduction techniques has been able to solve that problem by allowing the use of what? Semen donor. It's done all over the world. It's not only in Nigeria. All over the world, where infertility in this advanced form is practiced. You understand what I'm trying to say now? So that's called semen donor. So semen donor semen donor is also required. It's also part of what assisted reproduction techniques. We also have, it's vice versa. We also have some women who are already menopausal. In other words, the quality and the quantity of their ovaries or egg, they've gone down beyond reasonable doubt. It's not their fault, it's the age. The older you are, the lower the quality and quantity of your egg. It's normal. So, but what do we do for these women? And they desire to have children. They desire to have children. They were not born to be barren. For one reason or the other, they are barren for some reasons. God said there should be no barren in the land. There is no room for barrenness as far as the Almighty God is created. But thanks be to assisted reproduction technology, we screen some young female anonymous, then screen them, check them up genetically and whatever, then aspirate some of their eggs after some treatment, fertilize these eggs with the husband of this woman's sperm, and whatever that is formed is transferred to this recipient, which is the woman that requires it. But when you are young, when the woman is young, between the age of 35 down or 40 down, and the ovarian reserve is still very okay, the ovarian reserve means the reserve, sorry, let me just use the common language, the egg reserve of this woman is still okay. Then, through IVF, we harvest the woman's egg, fertilize it with the husband's sperm, subject it to some developmental conditions. After 5 to 7 days or 3 to 5 days, we transfer. This embryo is planted in the woman, and baby is born, and there is happiness in that home. So, oocyte donor is one of the assisted reproduction techniques in IVF. So we have what we call sperm freezing. Sperm freezing is also one of them. Some of these are men who are not residing in Nigeria or residing around. They want to travel. They cannot wait for the woman to be ready for any of these treatments, or for some medical reasons. We collect their sperm, freeze them for future purpose, for this woman to be using while the husband travel for some reasons. We also have oocyte freezing, the egg of the woman freezing depending on the age. We also freeze this egg for future purpose. Maybe the woman doesn't want to have children now, maybe later in life, but want to harvest the egg and freeze them. Freezing will keep this sperm and egg alive until they are about to be used. There is a research that has been done and it has been tested as successful. Womb transplant. There are some of these women who don't have womb. You can transplant the womb of another donor into this woman and use it to have your children. We have embryo transfer. It's another technique. Embryo transfer means after the union of the sperm of the man and the egg of the woman, what do you do next? Is to transfer. It's another assisted reproduction techniques. Now, finally, we have what we call surrogacy. What is surrogacy? We are talking about third-party reproduction. I repeat, third-party reproduction. This couple, they are very young. The man is okay by all medical standards or by all reproductive standards. The woman is okay by all reproductive standards. But unfortunately, for some reasons, whether medical reasons or whatever reasons, this woman has no uterus. What do? We'll get a third party to assist them to carry this pregnancy and deliver it. This third party is not the owner, never, genetically or whatever. It's just to help the couple to carry the pregnancy and deliver it and hand over the baby to them. That is surrogacy. It is a practice in assisted reproduction technology. Then we have what we call Preimplantation Genetic Diagnosis. I repeat, Preimplantation Genetic Diagnosis. To take care of those couples who are AS genotype. Because we normally advise them, please, if you are AS and the man is AS, please don't bother to go and get married. But now they can go and get married if they can afford to do PGD. The PGD will select the healthy embryos, those with AA or AS, from the SS through IVF and transfer to them. And they will get healthy baby without sickle cell crisis. Though very expensive, if they can afford it, but because of our poverty level among these our couples, so they should better avoid it. That is why it is being preached in the church or churches. Please, AS, avoid marrying AS. Don't tempt the Lord thy God. That is on that level. Therefore, the said PGD, Preimplantation Genetic Diagnosis, can also bring about male children or female children. You know, there are some tribes who will tell you, man, what I need, what I require from this my wife, male. We need male out of this 10 female or 4 female and so on and so on, because of inheritance. In some society like the place emphasis on male child. In some tribe they tell you female. Sorry, male. Some will tell you male. There are some couples who have male. They want female. We have a lot of them. But now, so there are some who have female, and they want male. So Preimplantation Genetic Diagnosis, or what we call sex selection, is 100% that is sure when you carry out assisted reproduction technology or techniques using Preimplantation Genetic Diagnosis. See, the summary of this area I'm talking about is this. The consequences of involuntary childlessness is very high in Africa, very alarming. The consequences. There you see some women, because of no child, they are ostracized from the society. They are even banished, driven away from the community, giving all sorts of people names just because they don't have any children. So in Africa, if infertility is viewed seriously. Thank you.
Okay.
Yeah.
What are the investigations to be carried out for couples that require IVF treatments? Okay,
thank you. For couples who require IVF intervention, let me use that word. IVF intervention. I told you. IUI means intrauterine insemination. The previous lecture, I told you the conditions, the criteria. But in IVF, one of the investigations to be carried out is similar to that of IUI. The tubes must be assessed. If they are blocked, they are potential candidates. The womb must be assessed. If there are abnormal things you are not supposed to find there, for the man, the semen tube must be evaluated, whether normal or abnormal, whether oligo or normosospermic. Name it. These are. They are followed by your genotype, blood group, all those routine investigations. Infection tests, name them. These are some of the tests that you must do.
Please, sir, can you tell the viewers at home what entails IVF and other techniques?
Yes, it's what I just mentioned. all the things I've just mentioned in assisted reproductive techniques are IUI, IVF, EC. EC means intracytoplasmic sperm injection. OD means oocyte donor. SD means semen donor. These are all part of this thing. We also have womb donor. You understand what I'm saying now? We also have sperm freezing, embryo transfer, Preimplantation Genetic Diagnosis. Yeah.
Please, what advice would you give our teeming young men and women of reproductive age?
Yes, that is a fantastic question. Our teeming young male and female of reproductive age, they should learn from the mistake of the elders. When you've achieved that reproductive age, periodically, occasionally go for checkup, what we call reproductive tests. For the man, go for SFA, seminal fluid analysis, just to know whether you are fertile or not fertile. For the woman, occasionally, if you have the needs, I'm not saying it is a must, but it's said. So for the woman, you should go for checkup, check your tubes, check your hormonal profile. All those things God gave to you to reproduce, you check them periodically, like hormonal profile, the thyroid hormonal profile, your antimonial hormone, name them. All those things you check, you do some scans. Because we've seen where 21 years old female require oocyte donor. You'll be wondering, the tubes are blocked. Why? So our teeny youth should periodically or occasionally do some minor checkup to know whether they are fertile or infertile. We've also seen where we invite some of these young guys to come and act as semen donor. Anonymous.
Okay, thank you very much, sir, for your time.
Yeah, thank you so much. It seems you are disturbing me. Let me face my work. Every day you keep on tapping my knowledge on this area. Very soon I will change the direction. So I will change my direction. So it's good to educate our audience, our viewers. There is no harm in seeking for knowledge so that you know where we belong. Thank you so much for your comment. All right. Thank you.